The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and it must be Friday, and indeed it is. We're coming at you live from the Scottsdale Air Park Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. Today is May the 19th, so we're more than halfway through the month of May. Hard to believe it. Time is just ticking by, and if this is the first time you have tuned into our show is about how our older adult population can live a healthier, happier life. How do they do that? They do that by listening right here. And it's not to me, it's to these extraordinary guests that I have here on the show. So today's no different. I've got a return guest, and I've invited her back because the area that she works in is so important to you, our listeners, and to our community to know about the work that she does. So without further ado, I want to invite back to the studio Katie Brenneman. She's with Stronghold Financial. Welcome back to Health Futures.
Thank you, Bob. Great to be here.
It's good to be having you here. So I really, for our listeners who may not have heard you on our show back in May of last year, May 6th, I believe you were here. So it's a little more than a year. Please indulge them and me in the work that you do.
Yeah, so we specialize in long-term care financial planning across the board, but our niche specialty is really Altex planning, which Altex is the state's long-term care program subdivision of Medicaid. And so we do a lot with Medicaid qualification for individuals, protecting assets so that people don't have to spend down to the really low thresholds that they think that they do in order to obtain eligibility for the program, and get that coverage in place to help reduce their monthly out-of-pocket care costs.
It's amazing the work you do, and I know this firsthand because we've referred a number of clients over to you. And really, I think it's really important for our listeners to know that there is this misnomer out there, right? And I would love for you to help clear that up, and that is, in order for you to qualify for Altex long-term care services here through the state of Arizona, you have to be destitute. You have to be nearly broke, and you need to have only X amount of money in your bank account, and you only can earn $2,000 and change a month. You know, I would love for you to kind of take us through that and really talk about that, because I think that is the work that fascinates me about what you do, because you never know until you have a visit with a professional like yourself or someone from your organization to know whether or not you qualify.
Yeah. So there are definitely financial eligibility requirements for the program. So there is a maximum amount of income that an individual or a married couple collectively can earn on a monthly basis. There's a certain amount of assets that an individual or a married couple are allowed to have. For a married couple, you know, there's some factors there that determine what that dollar amount looks like. And so people see these figures on paper and they think, well, I've got too much income, or I've got too many assets, so there's no way that I'll ever be eligible for this program, or I'll have to spend down the bulk of my life savings to get to that point. So they just don't think that the program's realistically a fit for them. And what's just not commonly known is that there are ways to, yes, legally protect assets. There are ways to restructure income and assets to obtain financial eligibility for virtually anyone. And so they don't have to spend down those assets so that they're gone and gone forever. If they work with a professional that knows how to plan properly, assets can be protected, income can be restructured, and virtually anyone can be qualified financially for the program.
That's so good to know. But many people don't really realize that.
No,
and they come to you, and they have no aspiration to actually even qualify until you do the digging and you do your work.
Yeah.
Amazing.
Yeah.
No, really amazing. And I think you said prior to us starting that you're seeing an increasingly more people that have assets come to you for advice and planning.
Yeah, we've noticed a trend over the last 1 to 2 years where the clients being referred to us, the average net worth is higher than it historically was. The clients are also younger in a lot of cases than they have historically been. And so I think those two things go hand in hand. People are getting sick younger, they're living longer and unhealthier. And so they're needing care at younger ages, they're needing care for longer periods of time. And you pair that with the fact that the cost of care has gone up with inflation over the years. I mean, 5% per year is historically what we've seen, but this last year in January, it was really more of like an 8 to 12% bump. And that's more on the assisted living and memory care community side. I know you could probably speak to the home care side more intelligently than I could, but those hourly rates have gone up substantially.
Substantially.
Yeah.
I've been doing this for 20 years. My family's been doing it for 30. There's an incredible resource out there, and you probably know it. Genworth has a cost of care calculation. And for our listeners, please go up to Genworth. Cost of care calculation. That's all you have to put in the Google bar. And I'm not here promoting them, and they are not a sponsor of our show. That's my disclaimer. But what's interesting is in all the years I've been doing this, this is the one resource that you can drill all the way down to the city level, state and city level, to see what the rates are for long-term care, home care services, skilled nursing, assisted living, even daycare. It's the first year, 22, because we got the 22 report in 23, where it was double-digit growth across the board.
Wow.
Across the board. And we were talking about assisted living and skilled nursing, in the way double-digit, almost up to 20%.
Man.
The increases are phenomenal. So, we in home care have seen such a growth in rates. And it's because minimum wage has gone up. Labor pool's really, really shallow right now, and it's really hard to find workers. And when we do, they're demanding higher wages, and therefore the cost of services have gone up significantly.
Yeah.
The one thing that's really interesting, and I don't know if you have the answer to this, is just that younger people you're seeing younger people needing these types of services.
Yeah.
That's not a really good statement on the health of our society, is it?
No.
It's really a sad statement that they're needing long-term care services at younger ages. I'm just curious. What do you see in terms of youth? I mean, you seeing people my age or younger?
It varies. I mean, we definitely work in the skilled nursing facility rehab world where there are always the really unexpected traumatic events like strokes and things of that nature. And yeah, I mean, 40, 50-year-old clients in those cases. But I think what we're really seeing as more of a trend is the dementia and Alzheimer's diagnoses are coming in the 50s, late 50s, early 60s, and people are needing that care at a much younger age, and they're physically healthy,
right?
Aside from the cognitive impairment. So the spouses in particular are really terrified about what the longevity there is going to be and how expensive that total care cost is going to be over the rest of their spouse's lifetime.
It's understandable.
Yeah.
It really is. We're getting ready to finish up our first segment. As you know, because you've been a guest here before, there are 4 segments. Each one's about 10 minutes long. And I really want to have you share with us in the second segment, share with us a little bit about your background and why you chose this as a profession, because I know you, and I know there's a story to it. And every one of us has a story. So if you would indulge me and indulge our listeners
Of course.
about Katie Brenneman and why she got into the space.
Definitely.
You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. We are down our first segment. I've got Katie Brenneman here in the studio. She has a company called Stronghold Financial. She helps with long-term care financial planning. We got 3 more segments. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our second segment. I've got Katie Brenneman here in the house, and she's with Stronghold Financial. They're a long-term care financial planning company, and they are doing amazing things for people right here in our community and helping them qualify for long-term care service and supports. So, Katie, I did ask you, teeing up this segment from our last, was a little bit about you and why you got into this profession. You could have done just about anything, and would love a little autobiography, if you would, a
Sure.
little info for our listeners.
Yeah, so my background's more on the I was a consultant for investment advisors and insurance professionals for over a decade. They all focused in the senior baby boomer retirement space. And at some point, I was ready to make a change and left the company. And my two longest standing clients from that firm were these two gentlemen, Ron and Rick, up in Idaho. And left the company, called Ron and Rick to let them know. And they said, well, what are you going to do? And I just said, I don't really know yet, but I'll figure it out. And they said, well, why don't you do what we do? We know that you have personal family experience with long-term care. And I'd been helping them with some consulting on the side here in Arizona for a few years. And so I said, you guys are crazy. You're up in Idaho. You go to these middle of nowhere towns. I'm in Phoenix, Arizona. Medicaid planning in Arizona's got to be a completely saturated market. And they said, just do a little bit of research and spend a couple days and let us know what happens. So for 3 days, I made calls. I pretended that my grandparents were still alive, my maternal grandparents, Mimi and Granddad, and that they lived out here in Arizona and that they were going through what they'd been going through years prior back in the Washington, D.C. area. And the story there is Granddad had to go into, we called it a nursing home back there. And Mimi was healthy and living at home, and they had several $100,000 of assets still at that point in their lives. They were in their 80s. But Mimi was terrified to write that check every month. It was a $10,000 a month cost, even back then.
Wow.
Yeah. And she would say all the heartbreaking things like, what if he lives too long, and what if I run out of money, and how am I going to be okay?
I think every family goes through this.
Yeah. I mean,
And
it's
so good that you played this thing out.
And it's just so sad because, the families are going through what is probably the most emotionally stressful time of their entire lives.
Mm-hmm.
And then you have to add the financial stress in on
Right.
top of it. And it's like, why does this even have to be something that they're thinking about or worrying about right now? So, being able to take the financial stress away,
Mm-hmm.
it's meaningful. It matters, anything that you can do to help and let them just focus on the emotional side of things in this new phase of life that they're in.
And be with the one they love.
Yeah.
Whether it be a parent, spouse, partner,
Exactly.
child. I mean, they can be in the moment rather than thinking about how are we going to make things work.
Right. So for 3 days, I just pretended they were still alive and they were here in Arizona going through this all over again. And I was the person in the family helping them navigate it. And what would I Google and what would I find and who would I call? And in those 3 days, I realized that you pretty much just find government jargon, honestly, that doesn't mean anything to the
Right.
common person. It's very confusing. And I found that there's lack of information and misinformation floating around everywhere. And so it was just really eye-opening how challenging it must be for the families to even find out that services like what we provide exist, that it's even possible. So it's just a really eye-opening experience. And I realized, man, there's a huge opportunity to provide education and information to people about what's possible, what's accurate, and to really help these families navigate a challenging time of their lives.
Amazing. And for you, this was the affirmation that this was the line of work you wanted to go into, because these guys in Idaho said you should be thinking about this. I'm trying to remember her name. John?
Ron and Rick.
Ron and Rick.
Yeah.
Ron and Rick. And after that event, you said, okay, I'm in.
Yeah.
Wow.
Yeah.
And how long ago was that?
End of 2017.
So you've got 6 solid years under your belt.
Yeah. Full time. Yes.
How's it been? Has it met your expectation? Exceeded it? I mean, what are your thoughts?
Exceeded. Yeah. I mean, I feel very lucky that the work, there's just so much, I'm honored that the families that hire us trust us.
Mm-hmm.
I really am. I mean, you're talking about the most personal things in your lives, your health and your money, with people you don't know.
Right.
But it's really interesting throughout the process of working with our clients, you get to know each other at a level that you don't get to know many people in your life like that. And the relationships that we develop are phenomenal. We continue to have an ongoing relationship with the majority of our clients long after we get them approved for the program. So we stay in touch over the years. And I mean, I have a number of clients that honestly feel like family. So it's been incredibly meaningful work. And sometimes I feel like I completely stumbled into it, but I believe that everything happens for a reason, and just very grateful.
And you see yourself doing this really till the end of time for you. I mean, really, I know for me in the home care business, the feelings I get in helping these families are feelings that they're hard to describe, but it's just so satisfying and gratifying to know that you are helping them. Both of us are helping them typically in their final chapters of their lives.
Yeah.
And being able to help them through this journey to keep them in peace and help them understand that being in the moment and not having to worry about these things are the most important thing.
Yeah.
Awesome, Katie. Wow. How fulfilling that must be.
It is.
Well, it may have found you, but I don't see you ever leaving this space. And, for me, it is incredibly gratifying for me to send people to you to help them through this journey to try to qualify for these benefits that I think you've said it before, that they've been paying into pretty much their entire working life.
Yeah.
Nice. So speaking about paying into, let's talk about costs. Long-term care, and you and I have talked about this before, people are not ready for this. People have not planned for this. So many people think that Medicare or their managed care insurance, and when I talk about managed care insurance, so everyone understands, that's Aetna, Cigna, the Blues, that's Humana, all these insurances that they have, they figure they're going to pay for long-term care supportive services, and they don't. So if you wouldn't mind, indulge me and our listeners a little bit in terms of what are some of these costs?
In terms of how much?
Yes.
Yeah.
Yes. Not so much to buy any type of insurance. What does long-term care cost?
Yeah, you're right. I mean, most people have a rude awakening when they find out that the health insurance ends at some point.
Right.
It covers a rehabilitative stay after a hospitalization, and for really not more than 100 days. And not many people even get that full 100 days in a lot of cases.
Yeah, a lot of times it's 20 or 21 days and they're pushing them out the door.
Right. Yeah. So when that health insurance coverage ends, people are blindsided. And so at that point, I guess it depends on what setting they're going to receive care in.
Mm-hmm.
If they have to remain in that skilled nursing setting for some period of time, we typically see that cost range about $6,000 to $9,000 a month. That's assuming that they don't need any type of treatment like dialysis, or they're not on a ventilator. If they have a trach, a ventilator, dialysis, I mean, that's ranging anywhere from $17,000 to $30,000 a month.
A month.
A month, yeah. I mean, unaffordable for anybody other than the uber wealthy.
Yeah.
If
and Medicare doesn't pay for that.
Once the coverage ends.
Yeah, the 100 days.
Correct.
Done.
Yeah.
Over.
Yeah.
Wow.
If someone's able to discharge out of the skilled nursing facility into more of an assisted living home or community setting, you can find care homes in the, I'd say, $3,000 to $6,000 a month range. The assisted living community settings, we typically see more in the $5,000 to $7,000 a month range. Memory care is going to be more in the $6,000 to $9,000 a month range, and then home care. The agencies that we work with typically say anywhere between $33 to $39 an hour. Is that still pretty accurate from your perspective?
It's going up.
Yeah.
Yeah, up to size 44.
Wow.
And you're getting 33, and I would question whether you're getting quality at 33 just because the caregiver wages are just so high right now. So high. So, I mean, literally, you're looking at anywhere from assisted living, and I'm just unpacking what you just said. So if you're looking like at an assisted living home, group home, you're looking at 3,000 or 4,000 on the low side. And then you're looking at, if you're needing a ventilator or very high skilled needs, you're looking at $17,000 to maybe $20,000 a month.
We've seen as high as $30,000
a month. That's just incredible. It really is. And 4 out of 5 people 65 and older are going to need this type of assistance at some point in time in their life.
That's the stat, yeah. And obviously none of us have the crystal ball to know. Are we the lucky 1 out of 5 that won't?
Right. And one of the stats that you'd shared with me is men need care for an average of 2.2 years, and women somewhere in the neighborhood 3.7
right.
years. Wow. You're listening to Health Futures, Taking Stock in You. We're at halftime here.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we are in our second half here. I got Katie Brenneman here in the studio. She is with Stronghold Financial. They are a long-term care financial planning company, and they've been at it since 2017 and really rocking this world and making a difference in the people's lives that need assistance in this long-term care planning stage. If you missed our first half, go up to our website at cypresshomecare.com. Click on the media button right below its radio show. You'll catch this one and many, many more. So we talked in the last segment, we were talking a lot about the costs of these services, and they range from as little as $3,000 or $4,000 to $30,000, which is just blowing me away. And Katie, some of the figures that I did share with our listeners, typical male needing long-term care supportive services is about 2.2 years, and females are 3.7 years. And you talk about those numbers, and you extrapolate them. I mean, if it's $30,000 a month, you're looking at, for a male, you're looking at about, $750,000.
Yeah.
It's crazy how expensive this stuff is. So, one of the things I want to really take our listeners through in this segment is really, how do we pay for long-term care, right? Is, we pay for it through, and I can take us through this because I always take our clients through it, is private pay is one way you can pay through it. Veterans benefits is another. Long-term care insurance, and I think the data point that I have is about 11% of our population has long-term care insurance. So not enough people bought it when it was affordable and when it was available. Now, good luck, because it's very expensive and it's really hard to find.
Yeah.
And then the last is Medicaid. It's not Medicare, it's Medicaid. And we spent the whole first half talking a lot about Medicaid. And, I think the misnomer, and I want to repeat it again, is that people think they have to spend down, right? They think they need to deplete themselves of all their assets,
right,
so that they can get onto this program.
Right. Yeah. I mean, what we found is that the bulk of people fall into this really uncomfortable middle, right? They say, I'm not the uber wealthy. I can't afford to private pay in perpetuity, because no one has the crystal ball to know on the front end how long you're private paying for that care for. Even if you look at the averages, the 2.2 and the 3.7 years for men and women, those are averages, right?
Right.
So some people need it for less, some people need it for more. That's how we arrive at the average. I mean, we've had clients that have been with us since the firm was founded, so 6+ years. So you just don't know where you're going to fall. And so it's really hard to know on the front end, even if I have assets, can I actually afford to cover my long-term care cost? And if it's a married couple and one of the spouses is healthy, in particular for that healthy spouse like my grandmother, it puts them in a terrifying position,
Right.
not knowing, maybe I can afford to pay for this for some period of time, but what about me? How am I going to be okay? So most people don't feel comfortable with the private pay option, and so they delay getting long-term care. And then the awful things happen, like the hospitalizations for the falls or whatever occurs.
Things get worse.
Yeah. And then people look at, on the other side of things, okay, so I'm not rich enough to pay for my care, but I'm too rich for Medicaid. And so they think that they've got to spend everything down to these really low thresholds in order to finally qualify for this program. And so again, they delay getting the care that they need and deserve because they think, I can't private pay for it, but I can't qualify for state assistance either. And people don't realize that if we're working with a married couple, we can protect 100% of the combined marital assets for the healthy spouse and qualify the spouse in need of care for the state's Medicaid program at the same time. If it's an unmarried person, typically 50 to 75%, sometimes more than 75% of the assets can be protected. But if people knew that they didn't have to spend down to these low thresholds and they could implement these strategies, how many more people would get the care that they need and deserve when they need it, instead of waiting until it's too late and that horror story happens?
And I think our message to our listeners is, look, you need to plan and you need to think about these things.
Yeah.
And if you wait till it happens, you are in the throes of all of that. And it's really hard to see the proverbial forest through the trees, right? I mean, it's like, you need to think about this. And none of this is sexy, guys and gals. I mean, it really isn't. I mean, this is real life stuff, but it is happening all around us. And you said in the first segment, you're seeing younger people come on to long-term care supportive services, which is a really scary thing.
Yeah.
Wow. Incredible. Well, I appreciate you walking us through in terms of how to pay for this. So, I really want you, if you could take us through, what is this long-term care thing called Altex? And, how do we get people to apply, and what is that process that people need to go through? Can you kind of walk us through that?
Yeah, definitely. So Altex is an acronym that stands for Arizona Long-Term Care System. And as we've talked about, it's a subdivision of Arizona Medicaid. So it's designed to provide long-term care financial assistance to the elderly or the disabled. And if you just think about why the state would want to do this, I mean, the purpose really is to, from a financial perspective, to keep seniors and disabled individuals out of the hospitals. Because if someone spends one day in the hospital, what's that bill? What's that Medicare bill?
Oh, it's huge.
Compared to if the state helped fund long-term care costs, it's much more affordable for the state to contribute towards assisted living services that are that much less expensive than one day in the hospital. So that's really the intention of the program, is to contain costs for the federal and the state budget on the medical side of things. And so in order to be found eligible for the program, an applicant needs to be found not only financially eligible, which is what we've talked about a little bit so far, but medically eligible as well. And so there's a specific assessment that's conducted on the medical side to determine, does this applicant meet that minimum standard of care that we're looking for? And they really are looking for a skilled nursing level of care. That's not to say that someone has to be living in a skilled nursing facility, but it's definitely not med management and a little bit of, queuing and reminders and a little bit of assistance with activities of daily living. And activities of daily living that are being looked at are the ability to walk around safely inside of your home, not out and about, inside of your home. transferring in and out of bed and chairs safely, showering, dressing, using the restroom, eating food, not cooking food, but the actual act of, food on fork, fork to mouth, chewing and swallowing safely without choking. And then grooming, which is considered shaving, brushing your hair, brushing your teeth. They are also looking at cognitive impairment. If there is Alzheimer's or dementia, that can help achieve medical eligibility. It's not enough in and of itself, believe it or not.
That's crazy.
Yeah. And then they're also looking at behaviors that commonly go hand in hand with Alzheimer's and dementia, which are wandering, resistive behavior, disruptive behavior, self-injurious behavior, and aggressive behavior. So all of these categories are taken into consideration, and points are assigned based on how they're occurring. And someone needs to score a minimum number of points to achieve medical eligibility. So from my perspective, that's actually the more challenging obstacle to overcome, because I can work within, the Medicaid policy on the financial side of things is very black and white. If you have too much income, I can work with that. If you have too many assets, I can work with that. We can restructure things. But someone does have to be at that base medical level of care, that need for help, in order to be found medically eligible for the program as well.
So there's a scoring system, and there are points. And I know you've shared it with me before. There's a certain threshold you have to get to based on those activities of daily living that you just described.
Right.
And we're talking about not preparing meals, but eating meals. We're talking about assistance with bathing, getting dressed, all of those things. Ambulating around your home, not outside.
Right.
And part of that is because I believe part of, you qualifying is you need to be homebound, right? You really, you can go out to like doctor's appointments and stuff like that, but for the most part, you're living at home.
Yeah, if someone's capable of getting out and about on their own without a substantial amount of assistance from another individual, they're likely not going to be at that level of help that's required.
Exactly.
Yeah.
Exactly. Wow. I can't believe it. Magic Bus, The Who, we're down 3 segments. James, man, did you just hit fast forward or something? 3 segments. We got one more to go with Katie Brenneman from Stronghold Financial. We're talking about long-term care financial planning. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our last segment, 4th segment, with Katie Brenneman from Stronghold Financial. She's got a firm that does long-term care financial planning, and it is really important for you guys to know this, our listeners, and I would love to give you a plug in terms of how to reach Katie. You want to go to strongholdfin.com or call her office at 480-390-0927. Really important for you to have this information for all the reasons that Katie shared. There's a lot of misinformation out there about how you can qualify, and I think, Katie, you debunked a lot of that here on our show today. But if you have any questions for her, please reach out to her, 480-390-0927. One of the things I want to get into before I ask you to give me some real life stories. I love, case studies, but for our listeners, we went through a lot of stuff about Altex, and you've shared some information with me here where in terms of costs. And I think it's, important for people to realize this, like for you to receive in-home care, you're not going to get 168 hours through Altex. I can tell you that right now. And you barely will qualify for 40 hours a week, because I don't think I have anyone at 40, but I have people in the 30s, and I have people in the 20s.
20 to 30 is the average of what we see allotted.
And you can really look at a lot of money in terms of, out-of-pocket costs if you don't go onto the Altex program.
Yeah.
And you gave a number before, $30,000 it could cost, was that a week to be in or a month to be in a skilled nursing facility? 24/7 care with in-home care supportive services on the private pay side is about that much.
Yeah.
It's between $25,000 and $30,000 a month.
Yeah.
It's a lot of money. And that's all with after-tax dollars. So important for you to know how to plan for this. And, it's that old adage, if you fail to plan, then you plan to fail. So, you know what? Even if you're not at that state, or if you think that, you got a loved one that may have been diagnosed with an illness or may be declining, it's time now to talk about these things. Don't talk about it when all of a sudden the bills come up, because there's a process. And Katie, I know that, Medicaid has opened up their offices right now to see who can qualify for coverage. During the COVID period, you could not lose coverage.
Correct.
During that COVID period. So if you were on Medicaid, you still stayed on Medicaid. But now they're making people be re-eligible, right? So there's a re-eligibility period right now.
Right.
And you and I have talked about it off the air. I mean, they're so understaffed. They're probably not getting to this re-eligibility in the fast enough time. But, you need to re-qualify for this. And that's got to be a huge task and a huge burden to a lot of people.
Yeah.
Wow. All right. Let's talk about some good things.
Yeah.
So I would love to hear about this case study. I think it's a Sam and Yvonne.
Yeah. So this is really a good example of what we're starting to see a lot more of, unfortunately, which is a married couple and one spouse having that Alzheimer's or dementia diagnosis at a really young age. So that was the case with Sam and Yvonne, who we qualified for the program at the beginning of the year. Yvonne is actually the one with dementia, and she's only 62. She actually has had dementia for about 5 years already and was living at home with Sam as her caregiver for years and years. But it just got to a point where it wasn't safe. It wasn't in either of their best interests anymore for that to continue. So time for Yvonne to move into a memory care community. And Yvonne's Social Security is only $700 a month. Her cost of care at the community is $6,400 a month. That's the private pay rate. And Sam and Yvonne, when Sam came to us, they had a total counted asset base of about $690,000 and some change. So when I say counted assets, like the home property isn't factored into that, a vehicle isn't factored into that. This was bank accounts, stocks, bonds, mutual funds, cryptocurrency, life insurance with cash value.
That seems like a good amount of money to have for
Right.
retirement.
Yeah.
Yeah.
And that's really, what we've heard a lot over the years is how could someone with that asset base ever qualify for this program, or why would someone with $690,000 ever have to qualify for this program? And the problem in their situation was the gap between Yvonne's income and cost of care was $5,700 a month.
Right.
And again, that's going to increase 5% per year on average for inflation. So that's already almost $70,000 a year of out-of-pocket care cost, the gap between her income and cost of care. 10 years from now, that's going to be a six-figure bill, easily north of $100,000. And Yvonne, being only 62 years old, physically healthy at the time, her husband came to us and he said, what if 10 years from now, Yvonne is still alive? I'm only going to be 75 years old 10 years from now. I'm physically healthy. How am I going to be okay for the rest of my life?
Mm-hmm.
And so Sam was terrified.
I would bet.
And we were able to show him, interestingly enough, he had called the Altex office before he called our firm. And he'd shared his situation and said, when will I be eligible for this program? And they told him, go spend down about $550,000 and then come back and see us.
Whoa. And there's a 5-year look back, right? So if he spent it down, he needs to wait before he can even qualify.
Well, and with married couples, the 5-year look back isn't, it's I'm not going to say it's not applicable, but spouses are allowed to transfer assets between each other to some extent. So it was really more how do we make sure that Sam doesn't have to spend down that $550,000 so that he's only left with $150,000 for the rest of his life. And we were able to protect all $690,000 total for Sam and qualify Yvonne for the program at the same time. And the net end result to them was that $6,400 a month out-of-pocket care cost went down to only $563 a month.
Whoa.
Yeah.
You saved him a lot of money.
70 grand a year
70
in today's dollars.
Yes. And Yvonne, how's she doing?
Last time I talked with Sam, he said that she's as phenomenal as she can be. She's very happy at the community that she's in. He goes to see her every day. It's right down the road from his house.
I love it.
Yeah.
So we got a little less than a minute left. I would love to leave our listeners with some lasting thoughts, or if there's a question I haven't asked, what question would you want to address during our time together?
I think what's really become apparent over the last couple of years is that $1 million isn't as much as it sounds like it is. You used to have $1 million and think I'm going to be okay. And when long-term care enters the picture, it throws a curveball in your retirement plan, and it just might not be enough anymore. And you've made reference a couple of times, Bob, to you don't want to wait until the crisis to plan. You're not really planning at that point. You're just reacting.
Exactly.
Right?
Yeah.
So the further in advance you start planning, you can actually plan. You have a lot more options, a lot more flexibility to create a better outcome.
And the other thing is the costs are going up. I mean, we talked about it, I think it was in the second segment, double-digit increases, percentage-wise. We've never experienced that before. Who knows what 24 is going to bring us, and who knows beyond that. So, I mean, we need to be really mindful of that. It's a shame that we can't really buy long-term care insurance anymore. But what we can do is we can be aware of all the ways we can pay for long-term care. And I think that's what Katie Brenneman and Stronghold Financial bring to the picture. So one more time, strongholdfin.com, or call Katie at 480-390-0927. Katie, thank you so much for joining me again here in the studio at Health Futures. Make it a great day. Have a great weekend. We'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.